disorders, it's about more than food. This is your concern talk for the month of February. During this training, we're going to define eating disorders, look at risk factors, and discuss different types of eating disorders. We're going to look at some of the causes, signs, and symptoms related to eating disorders, as well as look at ways to access and get help. What are eating disorders? Eating disorders are serious medical illnesses. They involve extreme eating habits, such as refusing to eat enough food, eating too much food, purging after meals, or a combination of these things. But eating disorders are not a lifestyle choice. They are truly a medical illness. Who is at risk to get an eating disorders? We all are. Anyone can have an eating disorder, regardless of your age, race, gender. It doesn't matter. It is more prevalent in teens and those in young adulthood, but you can have an onset later in life, even in your 40s and 50s. People with eating disorders may appear perfectly healthy, yet they can be extremely ill. So let's look at the different types of eating disorders. You have anorexia. This involves not getting enough calories in, which can lead to a significantly low body weight. People struggling with anorexia have an intense fear of gaining weight or becoming fat. They have a hard time recognizing the reality of what their current weight actually is. Then you have bulimia. This consists of recurrent episodes of binge eating along with some compensatory behavior. So this means people that are struggling with bulimia recurrently try to compensate for eating through fasting, self-induced vomiting, excessive exercise, use of laxatives or diuretics, or even medications. Then you have binge eating disorder, which consists of recurrent episodes of doing just that, binge eating. People struggling with binge eating disorder might eat much more rapidly than normal. They may be devouring their food. They eat until feeling uncomfortably full. They eat large amounts of food without really even being hungry. But then they feel guilty, disgusted, or even depressed after they have done this. You also have body dysmorphic disorder, which is an obsession with an imagery defect in physical appearance or an extreme concern about something really minor. It could be a blemish that they see as a huge scar, but nobody else may even notice it. It is this inaccurate perception of their body or a specific body part. They can be focused on their nose, their complexion, their hair. They get really fixated on some aspect of themselves that they don't like, but other people are not really aware of as an issue. But then there's some more. You have avoided restrictive food intake disorder, which is a disturbance that keeps people from meeting their nutritional needs. And these individuals can also experience significant weight loss. They have a major nutritional deficit, and they can then try to compensate by taking nutritional supplements, a lot of vitamins and things of that nature. You also have pica, which involves eating substances that have no nutritional value at all. Somebody that is struggling with pica might eat something like clay or soil or paper or flour or cornmeal. And when I say flour or cornmeal, they are eating it not as part of a recipe or anything like that. They just can't stop eating cornstarch. You also have rumination disorder, which that involves repeated regurgitation of food. The person could be rechewing their food, they could be re-swallowing it, or they could be eating it and then spitting it out. The thing is, they're trying to avoid ingesting it, thinking that it won't count and it won't be a weight gain. You also have other disorders. One is called purging disorder. And this occurs when someone purges without the benefit of the binge eating. They just want to get food out of their system, even though they haven't done the overload that happens with binge eating. Then you have night eating disorder, which is a person who consumes at least 25%. Typically, it's more like 50% of their daily intake after they have eaten their evening meal. So not just a little midnight snack, but we're talking a large food intake after they should technically be full. So what are some numbers that matter here? If you have 304 million Americans, and that's probably not counting minors possibly, there could be 7 million women with an eating disorder and about 1 million men. But the number that's most astounding is that there are 152 million people who know someone that has an eating disorder. Now, this doesn't say you are really aware of the person's eating disorder, but you're connected in somehow in a meaningful way to someone in your life that is suffering from an eating disorder. Could be a coworker, could be a family member, could be a friend. But that's saying half the population will know someone that is dealing with this issue. And that's a big deal because eating disorders are among the deadliest mental illness, second only to opioid overdose. That's huge. So, what are some of the causes of eating disorders? They can be genetic, social, or psychological. You know, somebody could be dealing with low self-esteem, feelings of helplessness, depression, anxiety, or just feeling alone. They could come from a dysfunctional family. They could themselves have difficulty with relationships. They could have experienced a lot of criticism about their weight at a young age coming from people who are significant in their life, like parents or siblings or teachers or coaches. They could have been someone who has suffered from physical, sexual, or verbal abuse. They could be influenced by the media, cultural things, peer pressure. They could have even have a more genetic connection in that they have a parent that they have watched be obsessed with their weight and body image. So there's so many things that can cause an eating disorder. For some, eating disorders are the result of an extreme need for control or a constant need for acceptance. So let's look at body image because that plays a huge role in it as well. Body image is defined as someone's thought or perception and their attitude about their physical appearance. Positive body image is a clear, true perception of your shape, seeing the various parts of your body as they really are, and being satisfied with that. A negative body image, on the other hand, involves a distorted perception of one's shape. That negative body image leads to body dissatisfaction. It can involve feelings of shame, anxiety, and even being very self-conscious. While there is no single cause of eating disorders, research has shown that body dissatisfaction is the best known contributor of the development for those who have anorexia as well as bulimia. So let's look at signs and symptoms. Someone that has a drastic change in diet, they could do dietary restrictions, be really, really intense about their fear of gaining weight. They could have behaviors around food and eating that are really rigid. They could routinely skip meals. You could find them playing with their food or always claiming that they're not hungry. They could excuse oneself during meal times or after meal times to go to the bathroom. A sudden fixation on physical appearance, justifying dietary changes or obsessions, or working out for being healthy. I have a lot of moms concerned about their daughters and sons becoming vegetarians, not connected to the care of the way animals are slaughtered, but focused because they really are hiding an eating disorder. They could demonstrate distorted thinking when confronted about their new behaviors. There's an inability to see the extremism in their actions. They could also exhibit things that are physical signs like a loss of hair, things going on with their teeth, and that's really long term that comes into play. A change in skin tone, and even a lack of energy could be a sign. Those who can become all of a sudden really fixated on taking in nothing but caffeinated products, like drinking coffee all day but never really eating any food. And once again, look for the signs of laxatives around or smooth move teas and things of that nature. Those are all things to be aware of. But what are the consequences of eating disorders? Well, if you look at these numbers, once again, we have to be concerned. So the good news is 35% of those with anorexia can make a full recovery. That is awesome. However, 7.5% of anorexics can die within 10 years. 19% can die within 20 years, and that's without any intervention that holds. A lot of times they are in and out of treatment just like others who suffer with addictions. But we have to be aware that eating disorders are a serious medical condition that can affect all organs in the body. And anorexia is the third most common chronic illness among adolescents. Both anorexia and bulimia can have serious and sometimes irreversible medical complications. But what are some of the ways to get help? What are some of the treatments that work? Cognitive behavioral therapy, or CBT, is the most commonly used and most effective because it is getting at the way the cognitions, the thoughts, impact the emotions and feelings, which will impact the behavior. So doing things like keeping a diary to monitor the food intake, having a set meal plan, being able to disrupt the dangerous behaviors, being able to address the way they over-evaluate, disrupting that negative thought process that's feeding this, being able to address the issues of control, and being able to just challenge things in a very real way. And sometimes it takes more than just a therapist. Sometimes you need a nutritionist. Sometimes you also need a medical doctor, because remember, there are a lot of medical complications that can come with this. But pay attention to what is going on with yourself and those in your life. Eating disorders are on a spectrum. So you've got to look at what was that person doing before, and have you noticed an extreme change? Or sometimes you can see the beginnings of it with a minor change. But when we pay attention to things that are going on with those that we love, are they thinking about food all the time? Are they being rigid with their diet? Are they obsessed with their weight and body image? Pay attention, and if you are concerned, then you know what you can do. Reach out for help. Concern is a great place to start. We have telehealth video sessions and telephone sessions available now because of COVID. Hopefully at some point we will get back to face-to-face, but these are meaningful methods of intervention to get help. Remember, whether this is you or someone else in your household, help is available, always at no charge. If you have a question, you can call us or you can email us, which is very convenient for a lot of people, concern@bmhcc.org. But if you prefer to call, know that no issue is too big or too small. Our services are always confidential and always free for you and anyone who lives in your household. So give us a call at 901-458-4000 or 1-800-445-5011. Thanks for joining me for this Concern Talk.